Welcome back. Now, London's Mayor Sadiq Khan has declared a major incident as the spread of coronavirus threatens to overwhelm the capital's hospitals. We can get reaction to that from urgent care doctor Rees. Now, good to see you this evening. Thanks for being with us. What do you make of this announcement then by the Mayor? Is it the right thing at the right time?
Good evening, Jonathan. And 100%, it is absolutely the right thing. And unfortunately, sadly, it's also entirely predictable. Anybody that has any understanding of how this disease works is that it thrives on contact in close spaces. And many of my friends and colleagues on the front line and clinicians and scientists that understand this disease will have had their head in their hand when, before Christmas, we were being told that, yes, we've clamped down enough so that it's apparently safe to suddenly meet. Countries around the world were not doing this. If you look at Germany, Angela Merkel was saying that 5 excess deaths is too much, let alone 500. Therefore, this year, she told the German people that we're just going to have to cancel Christmas. Unfortunately, in this country, we've had very mixed messaging. People made plans in accordance with what the guidance was. And then, quite frankly, it's not enough for the Prime Minister to come out and say, oh, actually, a few days before Christmas, we'd like you to have a merry little Christmas. So it's not just the new strain. It is, there was numbers before this ticking up to say that it was a problem.
But the government did stop people mixing in London at Christmas. Households weren't allowed to mix. Everyone had to stay at home, Tier 4 measures and the like.
Sure.
So are you basically saying that people didn't obey the rules because the message came too late?
I think we need to get away from blaming people in terms of not obeying the rules, because the messaging is so different and it's so changing. What we need is clear, consistent messaging. And we also need a strategy. We need a strategy to move towards zero COVID, where we eradicate it immediately. We had a head start. We were 2 weeks before Italy at the beginning of this pandemic. And unfortunately, the plan that was instigated from a UK perspective was one based on flu, not one based on a SARS-type virus, which is what this is. And if you look at the countries that have dealt with this very well, Vietnam, Asian countries, people that have had experience with this in the past, they will wear masks, okay, and they will be happy with that. They will wash their hands. They will practice the respiratory etiquette. Unfortunately, the messaging has been so shambolic, and I said this right at the beginning, the messaging has been so shambolic that people are confused, and what we need is clear, consistent messaging. And we owe it to the people, my friends and colleagues that are full-time on the front line, that are saying that it is like hell, because what we need to understand is that this is a virus that can overwhelm any healthcare system in the world, whether it be the NHS or any other. No matter how well funded it is, any healthcare service in the world, if this virus runs out of control, you are talking about not being able to do routine care. We already know in the original lockdown and the months subsequent to that, people have been dying from preventable causes at home. They've been having their heart attack at home, where if they got to a hospital and had intervention, they would potentially be with us today. That's not even thinking about the people that have sadly lost their lives from COVID-19 and the 600 healthcare professionals on the front line as well.
Yeah, I suppose just to pick on a couple of things you said, it's difficult to compare ourselves, isn't it, with other nations, perhaps particularly in Asia, where the culture is obviously very different. And also we know that countries throughout Europe are struggling just like we're struggling, and no one could have predicted this much more transmissible strain. Having said all of that, the Mayor says...
On that point, I hate...
Yeah, go on.
Sorry. I hate to chip in, Jonathan, but we could have predicted a more transmissible strain. If you look at the messaging coming out from government at the moment, we know that viruses, the scientific community know that viruses left unchecked for the longest period of time, the evolutionary speaking, they will change, they will modify, they will adapt, they will do everything in their power to continue living and infecting more people. So we do know that, but to be fair, yes, European countries have handled this worse than the Asian countries, but then equally that probably wasn't helped by information not coming out of China in a particularly forthright way at the beginning of this.
Yeah, you make some very interesting points. Thank you very much. Dr. Rees, urgent care doctor, good to see you. Thank you.
Cheers, Jonathan. Take care.
You're watching the News Hour. Coming up next, Donald Trump says he won't be attending Joe Biden's inauguration. We'll bring you all the very latest reaction. Adam Bolton is in Washington.